Part 4 of this training continues the discussion of the vaccination procedure. The learning objectives for Part 4 are to differentiate between types of vaccine, syringes, and needles, recognize the appropriate steps in the vaccination procedure, and list the recommended contents of a vaccine certificate. Rabies vaccine is supplied in two types of vials, multi-dose and single-dose. The type of vials you will use depend on where you obtain the vaccine. We'll discuss both types of vaccines so that you'll be prepared for either type. Syringes are supplied in multiple sizes and different measurement scales. Syringes can be labeled with either the cubic centimeter scale or the milliliter scale. The actual volume is the same. 1 cc is the same as 1 ml. Syringes for vaccination clinics are usually provided in either the 1 cc or ml size or the 3 cc or ml size. Needles are also supplied in various sizes. The standard size for animal vaccination is 22 gauge. A smaller 25 gauge needle can be used for very small dogs, puppies, and kittens. A new needle and syringe should be used for each animal, regardless of what type of vial is used. The volume in a single dose vial is 1 cc or ml, which is the full dose of vaccine for both dogs and cats of any age. To draw up the vaccine, turn the vial upside down, insert the needle into the vial, and draw up its entire contents. The vial should be saved so that the label information can be transferred to the vaccination record. A multi-dose vial will be used for several animals. The amount to use for each vaccination is described on the label. Most commonly, this is 1 cc or ml. The vaccinator should wipe the vial top with alcohol, turn the vial upside down, insert the needle, and draw up the correct amount according to the label. Vaccinators should create only one dose at a time for each animal. Do not use a large syringe with multiple doses for multiple animals. Occasionally, very small air bubbles will appear in the syringe, which are safe to inject in the animal. Larger bubbles in the syringe should be avoided to ensure that there is a proper vaccine dose within the syringe. Large bubbles occur when the tip of the needle is above the fluid level in the vial when the vaccine is drawn out. Vaccinators should never re-inject unused doses back into a multi-dose vial. Unused, pre-drawn syringes should be discarded. While it's not required to give the rabies vaccine at any particular location on an animal, most are given in the skin over the right rear leg or hip. A standardized vaccination location simplifies the process for handling and restraint, and for addressing any adverse reactions to the vaccine. In the event that an animal is difficult to handle and the right rear limb is not accessible, a different subcutaneous location is acceptable. To administer the vaccine, first load the syringe and set it within arm's reach in a place where the needle will stay clean and safe. Find an area of loose skin over the right hind leg or thigh. Gently pinch the skin between your thumb and forefinger. Pull the loose skin gently upward and look for a small indentation of skin between your fingers. Pick up the syringe with your other hand and insert the needle under the skin in the indentation. Keep the needle parallel to the surface of the skin. If you angle the needle too much either in or out, you may enter a muscle, go through the skin to the opposite side, or stick your own finger. Once the needle has been inserted, draw back slightly on the plunger of the syringe using one finger. If you see blood coming back into the needle hub, remove the needle and try a different location. If there's no blood, push the plunger forward to empty the syringe. When the syringe is empty, remove the needle, backing out along the same path that was used to enter the skin. Check the area for bleeding or a small amount of leakage of the vaccine. If this happens, use a clean tissue or cotton ball to gently apply pressure to the area for 15 to 20 seconds. If more than a few drops of the vaccine are detected in the fur because the animal jerked away or the vaccine went all the way through the skin, start over with a fresh syringe and full dose. Discard the syringe with the needle in a safe container. The syringe and needle can be carefully discarded without replacing the cap, which is often safer than attempting to recap the needle. In addition to the risks caused by animal handling, the use of needles also poses a risk to vaccinators, handlers, and pet owners. This risk is much lower than in human healthcare environments because there are no known diseases that can be transmitted to humans during pet vaccinations. The accidental injection of small amounts of rabies vaccine is also considered low risk for humans. The risk of physical injury from needles, however, is fairly high. Needles can cause deep puncture wounds or scrapes to hands, arms, legs, feet, and even faces or eyes during and after vaccination. Many needle injuries are caused by improper disposal. The U.S. Occupational Safety and Health Administration, or OSHA, provides best practice guidelines for the management of used needles and syringes. Although federal regulations don't apply directly to tribal lands, they're useful for creating a safe disposal plan. Additional information and resources can be found at the OSHA website. Used needles and syringes should be discarded immediately in containers that are closable, puncture-resistant, leak-proof on the sides and bottom, labeled clearly, and labeled or colored red. During vaccination clinics, sharps containers should be easily accessible and located close to the area where sharps are used. The containers should be maintained upright throughout use and replaced routinely and not allowed to overfill. When moving containers of sharps from the area of use, the containers should be closed securely. Sharps containers should not be emptied or reused. All sharps wastes should either be incinerated or decontaminated by a professional agency providing this service. Please contact the IHS or your tribal healthcare clinic for assistance with obtaining and disposing of sharps containers. Each tribe may develop their own protocol for vaccination record keeping, but certain requirements will be established for the use of vaccine provided by the IHS. This training provides basic recommendations for the content and maintenance of vaccine records. In order for a rabies vaccination to be recognized by state law, it must be administered or supervised by a licensed veterinarian. Lay vaccinators should be aware and should inform the pet owner that vaccines which are not administered by a licensed veterinarian are not valid for international travel, may not be accepted by service providers such as groomers and boarding kennels, and that vaccine manufacturer guarantees may not be valid. In the event of a rabies exposure or animal bite, and regardless of vaccination history, each case will be evaluated by the New Mexico State Public Health Veterinarian. He or she will determine the disposition of the animal and if post-exposure treatment of human victims is needed. Rabies vaccines must be well documented to allow for investigation of animal bites. The vaccine certificate will be used by public health authorities if the animal is exposed to rabies or bites a person. A rabies certificate should include the name and address of the owner and the pet's name and identifying characteristics such as breed, color, sex, and age. The certificate should also include the date of the vaccine administration, the product name, manufacturer, lot or serial number, the due date of the next vaccination, and the route and body location of the vaccine. A lay vaccinator should include their name on the certificate, but should not sign their name on the veterinary signature line. Much of the necessary information for the certificate is found directly on the vaccine label. The label sticker can be removed and placed on the certificate when using single-dose vials. The owner should be given a copy of the rabies vaccination certificate. A copy should be retained by the lay vaccinator program or tribal official, and a copy given to the IHS for IHS-provided vaccines. Lay vaccinators trained through this program have limitations on the vaccines they provide. It's expected that lay vaccinators will provide rabies vaccine only to dogs and cats owned by tribal members. Lay vaccinators may also only vaccinate animals while on tribal lands. To do otherwise is a violation of New Mexico state statutes. The program also does not provide certification for vaccinating livestock or other animals, or for administering other vaccinations. Lay vaccinators are expected to keep organized and accurate records of rabies vaccinations and are expected to assist with rabies control efforts and investigations in their community. This training provides a foundation for the development of an effective tribal rabies control program. You should also view the videos provided by the Indian Health Service that demonstrate the concepts in this presentation. During your hands-on training, veterinary staff or a certified lay vaccinator will demonstrate how to give an injection. Please attend an IHS Lay Vaccinator conference or contact a certified lay vaccinator for this next step in your training. The contact information for several important agencies and individuals has been included in the Lay Vaccinator packet. Please use this resource for questions about rabies disease and the management of animal bites, and to complete your certification and obtain rabies vaccines from the Indian Health Service. Thank you for participating in the Lay Vaccinator program. Your commitment to learn about rabies prevention and control and how to provide vaccines safely and effectively will improve public health and safety in your community.